watching CBS 2 News This Morning in high definition.
Good morning, 6:44 right now. Last year there were about 85,000 amputations in this country, mostly toes, feet, and lower legs, and by far the most common victims were diabetics.
But Dr. Max Gomez is here this morning to tell us about a simple way diabetics can help prevent the dreaded foot infections and the amputations. Good morning.
That's right. Good morning, Kate. Good morning, Maurice. As you well know, poorly controlled blood sugar in diabetes can lead to heart disease, stroke, and kidney failure. But perhaps the most feared complication of diabetics is progressively losing parts of their toes, feet, and legs. But diabetics can take charge of their own foot health. Here's how. Arlene Scutch was a Broadway star in the 1940s, and like many dancers, she's had her share of foot problems. Arlene's foot problems stem from her 40-year battle with diabetes. Diabetics often suffer a double whammy that leads to amputations. It starts with neuropathy, a nerve condition where they lose feeling in their feet.
They've lost their protective sensation, so if they do hurt themselves or injure themselves, they can't feel it.
In other words, a small sore from a shoe that rubs or a splinter or pebble can turn into a full-blown infection because diabetics can't feel it. To make matters worse, diabetics have poor foot circulation, making it harder to heal an infection. Podiatrists like Dr. Perlstein are trained to spot potential problems early on, but patients can't come in for a daily exam, so instead...
The key really is to have the patient examine their own feet every single day, and therefore by doing that we can prevent some of the other problems that can occur.
The diabetic should look for sores, red spots, blisters, irritations, scaling, anything that wasn't there before or just doesn't look right. Use a mirror to look at the soles in between the toes. That's what Arlene does.
Examine the feet and rub creams into them so the skin is soft and doesn't crack.
Every day?
Every day. It's a ritual.
Now, in addition to daily self-examinations, finding shoes that fit properly is important, and regular visits to a podiatrist are also key, especially if you find something that doesn't look quite right. It's all about catching a problem before it becomes an infection, because once that happens, those can be very, very difficult to heal.
You also talked about how mirrors can help you see the soles of your feet too, right? But not just any mirror.
Well, that's right. I mean, you can use sort of a regular mirror, but if your vision isn't so great, which as you get older, that can happen, you can use those magnifying mirrors. It's similar to what a lot of women use for makeup. Magnifying mirrors on the bottom of your feet, that gives you a little better vision. Another thing you can do is enlist a family member to help them kind of take a look and see what's going on, because not everybody can sort of bend over and take a good look at their feet.
You bet.
Okay.
Lend a hand. Thanks, Max.
You bet.
Talking about the forecast, John, what's going on today?